If a tree falls in the woods and no one is around to hear it, does it make a sound? Have you ever felt that your voice goes unheard? And you think that you can make a difference if only someone would just listen? It's time for women in business to have a place to step into your power, a platform to embrace your hopes, dreams, and your visions, a voice to heal and restore. Your voice can make a difference. We have the platform to share your story and let your voice be heard. Be kind to yourself. Give yourself the chance to be heard and shine bright. Contact New Dawn Media by texting CAFE to 80800. That's CAFE to 80800.
Good evening again. I'm Yolanda Santana, and you're listening and watching your Hometown Health Show. Tonight we have as our special guest Dr. Rodolfo Carrillo, cardiologist, Florida Premier Cardiology. And we also have Teresa Hilton and also Ileana Ferreira, although you don't see her, she's off camera as support.
On the sidelines. Yes. Very important.
So we were talking a little bit about some of the things that set you apart in your practice, and I think you were talking about closure fast procedure, which is amazing. Maybe we want to talk a little bit more about the different modalities that you offer, or some of the trending modalities.
In terms for the veins, or for just cardiology in general?
In general.
In your practice?
Yes.
Okay, sure. So I think that starting with the non-invasive modalities, besides the plain old EKG that we all know that you get at your internal medicine doctor, we offer echocardiography and vascular ultrasound. Our practice is certified by the International Intersocietal Commission in Echo. So we are certified to do most advanced ultrasound studies, both for cardiac ultrasound as well as vascular. We do ultrasounds of the carotid arteries, looking for carotid vascular disease that can cause strokes. We do ultrasound on the abdominal aorta, ultrasounds of the veins, as I described before, as well as the arteries. We do arterial ultrasound. We perform the ankle brachial index testing to screen for peripheral vascular disease, which is blockages in the arteries on the lower extremities, in the legs. It's a very easy non-invasive test where we take blood pressure measurements, and we use an ultrasound probe to obtain the pressures of both the arms and legs at the same time. The general rule is that the blood pressure in the legs should always be equal or higher than the blood pressure in the arms. If there's a difference in the ratio is reversed. That's a screening indicator that there could be peripheral vascular disease in the lower extremities. So if we find such an abnormality, then we can do vascular arterial duplex ultrasound to confirm the presence of atherosclerotic plaque in the lower extremities. That's as far as we do for ultrasound. As I said, we have nuclear medicine in our office. We perform the nuclear exercise stress test. We perform exercise as well as pharmacological stress. This is to rule out myocardial ischemia or detect the presence of blockages in the arteries. We're very excited that in the next 2 months, we are going to have PET scanning, which is sort of like the latest, most modern, more accurate modality in nuclear medicine to detect the presence of coronary artery disease. So we're going to add PET scanning to our practice. In the hospital, as I say, in terms of invasive procedures that we can only perform in the hospital, we do the diagnostic cardiac cath, the stenting of the coronaries, of the lower extremities as well. We perform the transcutaneous valve replacement. It's a great advance in medical science and in cardiology, because now for the first time, since we're able to do this procedure, patients can avoid getting open heart surgery. Those patients that have a condition called aortic valve stenosis, where the aortic valve, which is the main outlet of blood flow from the heart to the rest of the body, that group of patients that get stenosis where that valve narrows due to calcification, aging, scarring, deformation of the valve, that valve gets scarred, and patients can die if left untreated. So now, via catheter, we are able to implant a replacement valve in there without the need for the traditional open heart
Right.
operation.
Yeah,
Um,
I've read about that.
it's very incredible. We offer the mitral clip procedure for patients that have a leaky mitral valve that are considered to be inoperable due to high risk. Just as in medicine, we have certain risk scores that we use to evaluate the risk of a patient that's about to undergo surgery, in this case of the heart. And when we find that a patient has a prohibitive risk that puts them at high risk of death during or shortly after the surgery, in order to avoid that, we offer them the mitral clip. The mitral clip is a procedure also done from the groin. We go with a catheter, we go from the right side of the heart, cross with a needle inside the heart, cross the chambers of the heart into the left side of the heart, directly into the mitral valve that's on the left, and place a clip to try to put together these leaflets of these mitral valve that are like sometimes very flimsy and very loose, and we just tie them up.
It's amazing.
It's like a little tummy tuck of the mitral valve to prevent
sure
it
you have
from
to be-
leaking and from being so flimsy.
The precision in that is just,
We
amazing.
certainly have to be very
You have
careful
to be
when we do these
precise.
procedures. They're not risk free.
Yeah.
Um,
You do a lot of those.
we are
few.
starting to do more,
Mm-hmm.
and we are very proud of the
That's
progress
good.
that we're making as we make
Mhm.
patients aware of the procedure. Sometimes they come in asking.
Yeah.
Patients are very savvy these days. And they
Sure.
look up everything on the internet.
Internet.
They read magazines. They see it on the newspaper.
Yeah.
Doctor, I want to have this procedure. I don't want to have
No.
open heart. Fix me with a clip. Fix me with a TAVR.
Yeah.
Sure.
Fix me. I don't want to have the cardiac cath from the
Yeah.
groin. I want to have it from the arm, because now we do radial access. For decades and decades, cardiac catheterization was performed using catheters accessing the artery in the groin that did not allow the patients to get up or to be mobile quickly. Since we refined the techniques of cardiac catheterization, we are able to perform our cardiac catheterization from the radial artery access, allowing the patient to essentially get up and walk and go home after a procedure with just a little band-aid in their
Amazing.
wrist,
Nice.
How far medicine
And-
has come.
and they can get a full
Yeah.
diagnostic workup or a stent. So there's definitely
Yeah.
a lot of advances, and
Sure.
we go to a lot of continuing medical education courses, and both theoretical and practical, to try to keep up with the skills. It's definitely an evolving field. We never stop learning anything new.
That's great. I mean, that's amazing. I'm floored with a lot of the
Yeah, a lot
procedures
of
that you're doing.
information.
For sure. What we have here, a peripheral arterial disease. What is that?
Peripheral arterial disease is essentially any disease of the arteries of the body, that excluding the ones in the heart,
Mm-hmm.
and is basically the formation of blockages due to atherosclerotic plaque, plaque made of cholesterol and calcium that forms in the arteries, and this can happen in any artery in the body, in the brain, in the carotid, in the neck, the carotid arteries, in the abdominal or thoracic aorta, in the iliac or femoral arteries, or even down in the popliteal or tibial arteries down in the legs. And we're very pleased to be able to help them. The relief in patient symptoms is amazing. Our field is probably one of the most satisfying fields in medicine. When we take care of a patient that's coming in with an acute STEMI, an acute myocardial infarction, acute heart attack, whether it's at 1 p.m. or at 1 in the morning, we literally bring patients back from the brink of death. They show up literally dying with crushing chest discomfort, in pain, crying in pain, short of breath, with a sensation of impending doom, sweating. We take them to the cath lab, usually within 20 minutes. We fix them up, open the arteries,
Amazing.
and I don't think there's very many procedures in medicine where you are like literally about to die, and within 20
goodness.
minutes with the procedures that we perform, you are back alive and you feel like back to normal. I don't think that even anybody having a C-section or a surgery
No,
can even
very
recover that
different.
quickly.
No.
So it's very
We're
satisfying.
lucky and
Wha-
grateful to have people like you in our medicine world that can
Thank
treat
you.
people. Thank you. What brought you into the field of medicine? Do you come from a family line of doctors, or?
I'm originally from Mexico,
Okay.
from Guadalajara, Mexico, and my father is now a retired OBGYN doctor there in Guadalajara. And I grew up since I was a little kid in getting involved with doctors, his friends, going to the hospital with him, going to his medical office or his OBGYN office. As I grew up and got into high school, I became more interested in medicine. And then just decided to apply for medical school. Went to medical
wonderful.
school in Guadalajara.
Okay.
With thousands of Americans go to study medicine. I came to the States shortly after finishing, started my residency up in Boston. I did 3 years in Miami of cardiology fellowship, went back to Boston to Mass General for the interventional cardiology fellowship, and then got recruited back to Florida.
Very nice.
So that's how it happened.
So this is home now for you, huh?
That's it.
Okay. Going back to your practice, what kind of insurances do you accept?
We accept everything. We don't discriminate against anybody.
It's fantastic.
We see HMO insurance, Medicare, Medicaid, and all their different varieties, commercial insurance plans. I won't say names, so it doesn't sound as a commercial, but pretty much every commercial insurance of every plan imaginable, we are on.
So people can call your office and just inquire.
Inquire,
And
feel with
ask what-
confidence. I pretty much take almost, I would say, almost
Great.
everything commercially available in Palm Beach County.
It's wonderful.
Yes.
Okay, great. And we're running out of time, but I wanted to touch base on how you work with Trilogy Home Health.
Trilogy Home Health, and Liliana's here. She's wonderful. It's a wonderful rep. Trilogy helps us with our patients. They help us take care of our patients.
Thank you.
When we need to refer somebody that has chronic edema, chronic swelling, somebody that needs physical therapy. Physical therapy is really one of the cornerstones of keeping patients healthy. It's not only about their diet or their medicines or the procedures that we do, but it's also the care that happens at home
Okay.
and the support they get from the nursing staff from Trilogy.
Dr. Carrillo, I want to thank you so much this evening for joining us and joining the show.
Thank you so much for the invitation.
Have a good evening.
Good evening. Bye.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com.